then just the nature of the way veterinary education is done in the UK, we do a lot of our early years with medical students. So a lot of my friends are actually physicians in the UK because we used to do our physiology and biochemistry lectures together, etc. So I'm not entirely divorced from the human medical field, and I'll come back to that a little bit later. The other things I should tell you is I am married to a wonderful wife who is also a veterinarian. And again, I'll come back to that in a moment. Well, actually, I should mention, this is why I do know something about the medical field, because outside of being a veterinarian and everything else, my wife has very poorly controlled lupus, which means she's been in hospital a lot. And a lot of our life is spent on the other side of the consulting room. I spend a lot of time with my wife going to doctor's appointments and interacting with the healthcare system. And I think that gives me a really interesting perspective, because in my professional life, I deal with patients, but in my private life, I'm often with a patient. So I get to see both sides of the consulting room. And again, we'll come back to that point. So first things first, I know most of you are sitting alone at home. You're not sitting next to somebody. If you were, what I would ask you to do is think about, what is your favorite story? Could be in a movie, could be in a book, could be a TV show, but I want you to think about, what is your favorite story? And then think about what it is that makes you like that story. So just give a couple of minutes there. Again, don't put it in the chat feature, because with 200 of you here, it'll whiz by and I'll never see it. But just think for a moment about what makes a great story, a story that you would not mind reading again, seeing again. I think a lot of us have a movie that we've watched more times than we would care to admit. All right, so just think about that for a moment. So what is it about a great story? What is it that makes humans like good stories? Because we know from the earliest civilizations, humans have told stories. They've told stories about heroes. They've told stories that are great love stories. They've told stories to explain the world around them. But we are naturally drawn to a story, because in stories, everything makes sense. Stories are great because they're like the real world, but they're better. Things work out in stories. I mean, just to pick from a story from the last couple of years, when Cap is standing there just about to be beaten to death by Thanos, there's no hope. You hear on your left, and the crowds of heroes come through the portals behind you just in the nick of time, and the good guys win, right? So stories make sense, and that is great. It's really nice to just for a portion of time inhabit a world where everything makes sense and things are going to work out. And there's even a bit of there's a kind of a story behind that. But just before we get there, think about why you are where you are today. Why are you at university studying for a career in healthcare? And I'm guessing there's all sorts of reasons behind it. It might be a family member, could be a good friend, could be an interaction with a healthcare professional. But I bet you would never admitted this in your interview, but you have also seen your healthcare profession described in a story. I mean, you only need to switch on the TV. There's healthcare dramas on pretty much every night. I know I'm dating myself because these are the ones I recall, but certainly, I mean, when I was in vet school, ER was required viewing. Every vet student, every medical student was watching ER. One of my colleagues once mentioned after I graduated that it should actually be classed as continuing education. But there's House, there's Grey's Anatomy is still on. And for those of you in the veterinary field, James Herriot's stories have shaped so many of our expectations. So stories have helped us choose our career paths. We read a story, we watched a story, and somehow or other we could place ourselves in that and think, that's what I want to do. So again, stories make sense. And this is often described, believe it or not, as the theory of narrative causality. There's something about stories making sense that makes us comfortable. So in any story you ever read, there's kind of a beginning and a middle and an end. Everything moves nicely. The other thing about stories is everything happens for a reason. Like things are ordered, they're structured, and that's wonderful. Great thing about stories is, for the most part, the boring bits are cut out. Not true of every story. Anybody who has ever read Moby Dick will know that Moby Dick did not cut all the boring bits out. But there are a lot of stories that just progress quite rapidly, which is great. In any story or movie, everyone is more attractive. Things are more vivid. And the baddies are always within splatting distance. You know, you can always get hold of the baddie, and generally the baddies lose. The good guys win and the bad guys lose, which is great. In movies, the human body can do so much more. You don't have to be a superhero. The heroes never get tired. They can get punched repeatedly. They can get up. They get shot in the shoulder, which apparently magically heals in movies. But the human body can deal with a lot. And in movies, violence is beautiful. What I mean by that is watching the bad guy get their comeuppance really makes you feel good. When the bad guy loses, you feel great about that. In movies, you can win someone's love. Someone who doesn't love you will fall in love with you if you pursue them, and it's not called stalking. And finally, in any story, individuals can make a difference. And just think for a moment, that's not the way the world works. We all know this. In the real world, things don't happen for a reason. Things sometimes just happen. Last week, I took my dog for a walk on a Sunday morning, took my dogs to the dog park like I always do, same dog park I've been going to for a year. I was there with some other people with dogs. The dogs were running around in the trees and found a porcupine. Suddenly, all the dogs have got porcupine quills in their snouts, in their faces. We all end up at the vet school. The dogs have to be sedated. The porcupine quills are removed. That didn't happen for a reason. One of the dogs has had emergency surgery because the porcupine quill tip broke off, migrated, and set up an abscess that's caused all sorts of problems. There's no reason for it. Sometimes stuff just happens. In the real world, things can be boring. In the real world, people get tired. People get hurt. And it's not good. Violence is not beautiful. Violence is distressing. And as I said, if you try and chase someone who doesn't want you, you can end up with a restraining order against you. And while individuals work hard and do spectacular work, it doesn't always make the difference that they're looking for. This is one of my favorite quotes from a fantastic author that I really enjoy. It's a British author who writes this fantasy science fiction comedy. But it's a wonderful quote about narrative causality. And it says, "Scientists have calculated that the chances of something patently absurd actually existing are millions to one. But magicians have calculated that 1,000,000 to 1 chances crop up 9 times out of 10. What I mean by this is, in the story, at the end, when the chips are down and there's a last thing that might just work, it actually works. In the real world, when the chips are down and there's no other chance and you try something stupid, it doesn't work. That's the real world. Again, this is why we like stories, because stories are a better version of the world in which we live. And so we love to see stories because that's how we would love the world to be. And unfortunately, the world just isn't like that. So unfortunately, the universe doesn't listen to us. The universe is not the way we want it to be, and people are not always the way they want it to be. And the consequences of this are, in a large part, frustration. Because you want something to be the way that it is, and it isn't. You want people to be a different way, and they're not. And this creates a friction. And this friction can really wear you down because things just are not turning out the way you want them to. And really, this is something that philosophers have struggled with. Why is it that we want something different from the way that the universe is? And can we be happy with this outcome? So what I'm going to do now is I'm going to take you through some of the biggest frustrations that I see in healthcare and just talk a little bit about them, and then we'll kind of deal with the ways that you can cope with this, because I'm not telling you that your career path isn't going to be rewarding. I'm not telling you that you aren't going to love your career path. But what I'm telling you is you're going to have to come to terms with certain things in your career that are going to annoy you. And if you can't come to terms with that, you're not going to be as happy as you could be. So the first thing I'd like to tell you is that bad things happen to good people. Right? In the movies, things make sense. Things happen for a reason, and generally good people, good things happen to. But that's not the case in the real world. And this really has taken me time to get my head around. So this is my wife, Dr. Kimberly Tryon. Some of the vet students have met her because she was in a lecture with me last week. But my wife developed lupus when she was a teenager. And her lupus was relatively not doing much all the way through vet school. But after vet school, when she did her internship, her lupus really flared up. And she has basically been in a continuous lupus flare for 25 years, which is not good for anybody. Now, the weird thing is, if lupus wasn't enough, anytime there is an obscure side effect or an obscure thing that might happen, it has pretty much happened to my wife. She was put on steroids. Steroids resulted in osteonecrosis. She's had multiple joints replaced. She's had more surgeries than I can count. She's had complications after pretty much every surgery. And I know, I wouldn't hopefully think I would not have married her. She is a wonderful, wonderful human being. She is a lovely lady. And she's just been dealt a shitty hand. And that happens. You know, you can question it, you can argue why, but I know it's not as a result of a decision that she made or something that she did. This is just the life that was sort of granted to her. And the reality is she has to come to terms with that. And as her husband, I've had to come to terms with that. When you go through your careers, you are going to meet some absolutely amazing patients and their families, people that you would love to be related to, people you like to spend time with, people you would happily go on vacation with because they just bring joy to your world. And bad things are going to happen to them. Accidents are going to happen to them. Bad diagnoses are going to happen to them. There's going to be side effects or adverse outcomes, even though everybody has done everything right. I can actually give you a perfect example of this. And this is one of those stories that I literally, this is how it happened. And I don't necessarily come across the greatest in it, but just be aware of this. So one evening, my wife and I are sitting at home watching TV. Suddenly, she grabs her abdomen and sort of doubles over. And I sort of look at her because I'm just about to start getting dinner to ready. I'm like, what are you doing? And she says, you know, she's in real pain. I'm like, really? Can I get you some Tums? Do you want I don't know, a hot water bottle? What's going on? About 5 minutes into this, because I am remarkably dense, I realized this is a big deal. So I managed to get her in the car and I drive her to hospital. So we get to hospital and they admit her and she's in a lot of pain. They give her some pain management. Anyway, nothing much is going on. I'm being a smart aleck talking about how I deal with horses with abdominal pain. And after about 4 hours, suddenly she's in an ambulance. She's going to another hospital. She has emergency surgery and she has a portion of her small intestine removed. She developed a blood clot in her small intestine and had to have major surgery. And we're really grateful. The surgeon that was on duty that night was an amazing guy, did an incredible job, saved my wife's life. I am eternally grateful to him. He is an amazing guy. Anyway, my wife does pretty well after surgery. A few days, about a week later, she comes home. Anyway, I'm very worried about her incision. I keep looking at it. I'm putting dressings on it. I am really worried. I take her back to hospital twice saying, I don't like the look of her incision. And I'm told, well, there's really nothing we can do, just look after it. So I've got dressings on it. I've bought a binder, and I've got my wife under a binder dressing. And on a Saturday morning in bed, she coughs. And she said, oh, that doesn't feel right. I said, oh, all right, whatever. So I take the binder off, take the dressing off, and her incision has split wide open, like top to bottom. I can see everything inside. So I think, well, that's not good. Sterile dressing, bind everything up, phone 911. I said, what do you need? I said, I'd like an ambulance, please. They said, why do you need an ambulance? I said, well, my wife had emergency surgery 2 weeks ago. She had an exploratory laparotomy that resulted in a small intestinal resection and an anastomosis. And her wounds just dehisced and she's eviscerating. And there was just silence on the phone. And the person said to me, what do you do for a living? I said, I'm a veterinarian. They went, oh, okay. Why do you think your wife's eviscerating? I said, because I can see her small intestines. And at that point, an ambulance came. Anyway, my point is, catastrophic thing happened to her. Not the surgeon's fault, not her fault. She's been on steroids a lot of her life. She doesn't heal well. And so she had to have surgery again. They fixed everything up. Now she's doing much better. But bad things are going to happen to good people. And yelling at the universe is not going to change that. If you flip that around, unfortunately, you are going to have clients that you don't like. You're going to have clients that you don't like dealing with, and really good things are going to happen to them. They're going to get good diagnoses. They're going to have easy recoveries from surgery. That's just the way it is. They might be rude to you. They might be insulting to you. They might be completely obnoxious, but they're probably going to get better some of the time. And just like everything else in life, you're going to have to learn to come to grips with that people, how much you like people or how you judge them morally is not necessarily going to have very much to do with the outcomes in a medical setting. So as I've said already, 1,000,000 to 1 chances occur approximately 1 time in 1,000,000. In the movies, they happen all the time. But when you are faced with a really bad diagnosis, when the chances are that the treatment is not going to work, it typically doesn't work. Now, the great thing is if you get a bunch of medical professionals together, lots of people can remember a story or something where it seemed to defy the odds. And they love to talk about those stories. But what they're not talking about are the other 999,999 times when things didn't work out. And so this is important to understand. Just because you think it might work, just because the chips are down and you think it feels like you're in a movie, that's when things typically don't work. And so that is really hard to get your head around. Clients don't understand this either, or patients don't understand this. They watch the same movies we watch, and so they sometimes think that when the odds are against them, that's a good sign. But no, it's really, really unfortunate. But 1,000,000 to 1 chances are not that common. This one is one of the hardest things, I think, to get your head around. I'm guessing that most of you here have done some basic statistics. And if you watch TV shows, you'll often see TV shows, they'll sort of say to the patient, oh, you've got a 60% chance, you've got a 90% chance, you've got a 20% chance. If they're saying that and it means anything at all, it's based off a population study. So what that study is telling you, if you've got a 60% chance, if you had 100 patients, you'd expect 60 of them to recover. That's great. The problem is you've got 1 patient in front of you. What does a 60% chance mean when you have 1 patient, or a 65% chance of success mean? Does that mean that every patient gets 65% better? No, it doesn't. It doesn't tell you very much. It gives you a sense of what might happen, but it tells you absolutely nothing about what will happen. Right? I believe, based on some of the stuff I've seen, the chances of my wife developing some of the complications that she developed is probably less than 10%. But it still happened to her, right? You cannot apply population statistics to the individual with respect to success or failure or anything else. The other thing is, when you look at population statistics, they're looking at a large population. Everybody we treat is an individual. So everybody we treat has certain things that make them higher risk, certain things that make them lower risk. And no one has done a study on 100 of the patients that you are sitting in front of you. So you have to get yourself to come to terms with the fact that, for the most part, common things happen. But every so often, something uncommon is going to happen. And that's just the way statistics is. And it doesn't mean you don't try. It doesn't mean you don't do everything in your power to get the best outcome. But you have to recognize that that's just the way things are. You cannot expect statistics to describe how your individual patient is going to react. This is perhaps one of the hardest things. I can't speak for the other healthcare professions, but we did a thing with the vet students where we were looking at personality profiles. And vet students, it turns out, are incredibly nice, empathetic people. And the thing about that type of people is they like to be liked, right? So we work really hard for our patients, or I know you are going to work really hard for your patients in the rest of your career. So you are going to sit up with patients all night. You are going to pull long shifts. You are going to be going back to the books, back to the computers, researching, trying to find more information, trying to do everything you can to get this patient through. You may end up being involved in some sort of very physical tussle where you are actually in a really difficult surgery for a long period of time. You may be there for a very, very difficult birthing of a cow, for example, where you may be physically exhausted. You may be performing CPR for a long period of time. You may be physically and mentally exhausted, and the patient pulls through, and you are standing there drenched in sweat, absolutely done in. But you've got this happy feeling because you've been successful and the patient is doing better. And then someone belittles you or says something condescending to you, or shows complete lack of gratitude, and it cuts you to the core. And the reality is, gratitude is a great character attribute, but some people are not very grateful. And you need to understand that when you have really put it all out there and pulled that patient through, the client may not be grateful. In our world, where we're operating fee for service, the client may scream and yell at you about the bill. They may think that it took too long. They may think that you should have made the diagnosis earlier. But gratitude does not equate with results. And that is a hard thing to get your head around. Again, most people are lovely. Most people will bring you gifts, cards. They will be ever so thankful. But some people aren't. As an aside, if you're ever in hospital or you're being dealt with through the healthcare profession, always remember to say thank you. Saying thank you goes a long way. I have learned over the years, my wife has been in hospital so many times. When I leave the hospital last thing at night, I always get the Tim's order for the morning. And so I always bring them coffee first thing in the morning, because my wife won't eat hospital food, so I have to bring her breakfast. But I always bring coffee with me for the nurses that were on night shift. So, demonstrate gratitude, but don't necessarily expect it. This is another thing that is just really hard to get your head around, and that is, in the movies, when you work really hard, you're always rewarded. Unfortunately, in the real world, it almost seems that the opposite is true. And let me just explain that, because I'm not saying don't work hard. I'm saying work hard for your patients, work for them like they're your family member. You need to advocate and work hard for your patients. But the reality is, the harder you work on a patient, it's probably because that patient is sicker, right? So when you get really difficult, life-threatening cases, you will work really, really, really hard on those cases. Again, you're putting long hours in, you're researching it, you're doing everything you can for those cases. But the reality is, those really sick patients are at much greater risk of dying. And so the harder you work on a patient, it sometimes seems that the ones you work really hard on are the ones where you don't get the good outcome. Those are the ones where the patient doesn't make it. And again, I'm stressing this. That doesn't mean don't work hard. It just means understand that the universe doesn't have a magic set of scales. You can't balance out the badness of their condition or their injuries by the effort you put in. Putting extra effort in, sitting up all night with the patient may be the right thing to do, but it doesn't bring the universe back into balance. You don't get to put your thumb on the balance of the universe in order to make your patients pull through. This is possibly the single most frustrating thing in medicine, which is that people make decisions against their own best self-interest. There are all sorts of things that will make your patients healthier. There are all sorts of things that will improve your client's quality of life. And we know that people don't do them. We know that people don't eat healthily enough. I know full well my diet is not as good as it should be. And with COVID and being stuck at home, I am suffering from the fact that I don't eat the way that I should do. We know that people will take recreational drugs, they will smoke, they will drink too much. And all of those things can have catastrophic effects on their health. They know this, they've read it, it's broadcast to them on a regular basis, and yet they continue to do it. There's all sorts of reasons why they might do it. And some of those people really do need our help. But the reality is they're going to do it. And even when you explain things to them, even when you give them good reasons to change, they may choose not to. People don't take exercise. We know, certainly in these days of COVID, where we're all stuck sitting behind a desk in our houses, we're not getting out, we're not moving enough, and we know that's good for ourselves. We know that people will discharge themselves from hospital against medical advice. They'll go against medical advice. One of the things that your generation are going to have to deal with way more than I did when I graduated is everybody now has got a cell phone. Everybody's got a data plan. You tell them one thing, they are going to Google it, and they're going to find some obscure, crappy website somewhere that tells them that you're wrong and they know better. You're going to be explaining to them that they need this medication. It's vital for their best interest to do this. And no, this website says if you hold this crystal in your left hand, you're going to be fine. And they're going to ignore everything you say. And you're going to have to treat them nevertheless. You're going to have to try to explain to them. You're going to have to work with them. But it's frustrating as hell. The thing that bugs me the most, my number one frustration, is vaccines. I'm an internist. I work with infectious disease in livestock on a daily basis. I know the value of vaccines. Vaccines are possibly the greatest development, I think, in medicine. In the history of medicine, nothing has made more benefit for mankind than vaccines. And watching people on television, having people tell me that they are not going to use a vaccine because it's dangerous or somehow or other abnormal, frustrates the hell out of me. But I still have to deal with them, and I still have to come to work, and I have to be able to understand that whatever I say, I'm not going to win that argument. Perhaps the hardest frustration, and I don't mean to seem depressing when I say this, but one of the truths of medicine is that every patient you ever treat will die. I pray that it's a long time from now, and I pray that it's got nothing to do with the decisions that I make. But the reality is that life exists for a finite time, and death is how life ends. And so we need to understand this as we work with our patients, that death is going to happen. And there are times where it is beyond our care or beyond nature for that patient to survive. This occurs with advanced old age. It occurs with catastrophic injury, and it occurs with severe disease. Death doesn't actually have to be the enemy. It is a natural part of our lives. In the past year, my wife and I have had to euthanize 2 of our pets. They were both very elderly. They'd had great lives. They had serious health conditions. And we elected, because that's something that we can do in veterinary medicine, that we would euthanize them at the end of their lives. And it was sad to see them go, but I also could look back on all the years that they'd been part of our lives and know that they'd had a good life and that they brought joy to my wife and I. The quote that I have on the page here is attributed to Hunter Patch Adams, who some of you may have heard of. And it's actually from the movie. So I've been unable to determine if this line was actually spoken by Hunter Patch Adams. But in the movie, it's spoken by Robin Williams, who's playing him. And this is a really interesting quote, because I think it asks us something about death. And so this is spoken in the movie by a medical student to a medical hearing. "What's wrong with death, sir? What are we so mortally afraid of? Why can't we treat death with a certain amount of humanity and dignity and decency, and God forbid, maybe even humor? Death is not the enemy, gentlemen. If we are going to fight a disease, let's fight one of the most terrible diseases of all, indifference." And so I'm not saying don't advocate for your patients, don't fight for your patients, don't try to keep them alive. I'm asking you to remember that death at the end of a long disease, after a severe injury, or after a life well lived, is a natural consequence. It is not a failure of you. It is not a failure of the medical system. It is something that happens. And again, you're going to have to reach a point where you're comfortable. So what I've described to you are some of the frustrations that I see in the practice of medicine, in the practice of veterinary medicine. But these frustrations aren't new. The fact that the world doesn't work the way we want it to is not new to us. And it has been asked by great thinkers throughout history. In fact, this question was really, I think, best immortalized in a book called The Myth of Sisyphus by Albert Camus. He was a philosopher in France around about the time of the Second World War. And he really struggled trying to understand, how do we deal with the fact that the universe isn't working the way we want it to? How do we as humans take comfort and do well in a world that doesn't bend to our will and doesn't react the way we want it to? And this really is the basis of a strain of philosophy called absurdism. Now, I stress, I am not a philosopher. I have not studied philosophy. I do not have a philosophy degree. I'm just someone who has spent a lot of time with veterinary students and talking to recent graduates, and have sort of struggled to comprehend what it is about the practice of medicine and veterinary medicine that can frustrate us quite so much. So absurdism really asks the question of, how can you survive in a universe that responds against expectations? How can you be happy when the universe is not doing what you want it to do? And The reason that Alexander Camus uses the image of Sisyphus, if you know your Greek mythology, and even if you don't, it doesn't matter. Sisyphus is a hero in Greek mythology, and he actually fights against the gods, and he beats the gods several times. And Greek gods, being vindictive immortals, decide to take it out on him. So after death, he goes to the underworld, and his punishment is that he has to push a huge rock up a hill every day. And he spends all day struggling to get the rock to the top of the hill. And at the end of the day, the rock rolls to the bottom of the hill, and he has to walk back down and do the same thing the next day. It's known as a Sisyphean task of doing the same incredible feat every day, only to have to repeat it day after day after day after day. And this is the embodiment of the never-ending thankless task. And what I ask you is, what does this have to do with medicine? What it has to do with medicine is it doesn't matter how hard you work on any given day. It doesn't matter how many successes you have. It doesn't matter how many hours you put in. It doesn't matter how many people you save today, because tomorrow when you walk through the door, there will be more sick people. There will be more of the same. You're going to see the same frustrations day after day. And what Camus asks in the book is, can Sisyphus be happy? Can you be happy doing the same thing day after day, struggling only to know that the next day is going to be exactly the same? And before I leave you feeling depressed, I want to tell you that you can be happy. You can actually learn to love your job. And what I believe anyway is that what you have to do is change your focus. Because in stories, everything is about the big thing. And humanity loves the big story, the big event, the huge thing. That's what we tell ourselves we should be taking joy in, is these huge events. And we've sort of reached the point where we're celebrating things at an unnecessarily large way. I'll just give you the example because it just has happened in the last week. We're looking at record-breaking fires in California. It turns out one of those massive fires was started because somebody used a firework for a gender reveal party. Gender reveal parties are getting so out of control that they're creating natural disasters, right? We want the big event. We really want the big event. What I'm telling you is that you can get so much joy and meaning in small events. Let me give you an example. If you tell yourself the only way you can be happy is by performing CPR and bringing somebody back from the dead, you're probably going to be unhappy. There are much, much bigger events in the great scheme of things that you do every day. If you are a general practitioner and a client or a patient comes in, let's say it's an owner with a brand new puppy, or it is a patient of yours who's just had a baby and they've brought their baby in to see you, and they have all sorts of questions and concerns about dealing with a newborn, whether it's a puppy, whether it's a human, and they have all sorts of questions for you, and you answer their questions, you take time, you calm them down, and you discover that underneath all of their concerns is they don't know whether to vaccinate. They've been on Google, they've seen stories, they're worried about whether to vaccinate or not. You take the time to talk to them, you explain about vaccines, and they decide to vaccinate their puppy, or they decide to vaccinate your child. What greater success is there? You have just changed somebody's life. You have calmed down that new owner, that new parent, and you have arranged for your exact patient to be vaccinated, which is going to make their lives healthier and better. That is a huge event. You don't get thank you cards for that. Nobody's going to do you a parade. But on a daily basis, you will achieve these things. On a daily basis, you will make a difference in people's lives. Again, no one's going to hold you a parade, but those little things when a patient comes in and they've got a laceration and they're bleeding and someone is really upset, and you can clean the wound, put some local anesthetic in and stitch it up, you have made a huge difference in somebody's day. You don't have to be doing spectacular things to make a difference. You don't need to be doing spectacular things to be happy. And you don't need other people's reaction to always make you happy. Knowing that you have done a good job is a really, really good way to spend your days. So my take-home message to you is that the universe does not bend to your will. It doesn't matter how many stories you've read, it doesn't matter how many TV shows you've watched. The reality is you are not an actor in a film. You're a human in the real world, and the universe is going to do what it's going to do, and you're going to have to react. What are your expectations of your career? Many of you starting out in your careers have observed a little bit. You've probably read books. Again, you've seen movies and TV shows. How much time have you actually spent in the trenches? What are your expectations for this career? And what do you think is going to make you happy and to enjoy your career? And the reality is you will have to determine, how are you going to respond to the absurd? How are you going to respond to the fact that the universe throws you curveballs? None of us back in December last year ever considered that we would be living through a pandemic this year. It was only 12 months ago I was speaking at IPASS and I was in a lecture theater with a bunch of students there. This has happened. You can decide that the universe hates you and that you've got to be able to do something to get the universe to come back on your side, or you deal with what life's thrown you and you try to find joy. You try to find little things that make a big difference in your life and other people's lives. And this really, I don't have the answers. I can't tell you how you're going to do this, but I'm saying to you that if you're going to be successful, you are going to find ways to see the joy in those small things. Alexander Camus, in his book, talks about Sisyphus savoring the walk down the mountain at the end of the day. There's a time where he's not pushing the stone. He gets to walk down the hill. Maybe he can enjoy the view, whatever it is. But there's something there that that can make joy in your day, despite the Herculean task that you face, despite the fact that there are all sorts of things around you that will frustrate you. And so with that, I'm going to sort of bring my session to an end here. I saw that there were some hands went up and various other things. So oh my goodness, the chat function has been flying away there. So Coyote, did you want to sort of summarize any questions or anything like that?
Oh, I'm not sure. Did they give the question directly to you?
Oh, sorry. Oh no, they're just people. Sorry, no, they're just people saying yes. Okay, sorry. I thought there were some questions there. I did see someone put their hand up though. So if anybody's got a question or a comment, I'd be happy to take it. As I said, I'm not going to promise to give you any great pearls of wisdom, but I'm more than happy to talk to anybody who has a question. I realize there's nearly 300 people here. Most people do not want to speak in front of such a huge crowd. So the other thing you could do if you want to is send me a private message if you've got a question as well, and I'll happily take it that way. I won't use your name. I'll just try and respond to the question. Someone else, where do I find my little bits of happiness? As I said, I think it's in the little things. I'll tell you right now, this is based off of my career. I'm a large animal veterinarian who deals with cattle. I'll tell you my two favorite cases. These are my two favorite cases, and it won't necessarily mean a lot to you. But the two favorite cases I have are lame cows. If I get a cow that comes in that's lame, there is a very, very, very high probability that she has a lesion in her foot. And if you give me a hoof knife, I will be able to trim her foot, find that lesion, and fix it. And so I can have a cow walk into the clinic who is three-legged lame, unable to bear weight. And normally within 30 minutes, I can get that cow to walk out and not be lame. The other thing that I love to treat, and this is just me because I'm weird, we see a lot of baby calves with very, very, very severe diarrhea. And it's not uncommon for baby calves to come in the clinic profoundly dehydrated with catastrophic metabolic imbalances. And because we've treated so many of them, and because calves are tough as hell, if you give me table salt, sugar, Arm& Hammer baking soda, and sterile water, I have a 90% chance that that calf will walk out of the clinic, even though it was unconscious when it came in. And so I take huge delight in these basic cases where I know I can make a real difference in an animal's life and to my clients. So I think that one really works. Do I think that has it got easier to deal with anti-vaxxers? No, it's got worse. I'll tell you that right now. In 25 years of practicing, the internet has taken off, and anti-vaccination always existed, but nothing like it is now. Yeah, I wish I knew, and I'm not at the sharp end. Dealing with the large animals, we don't run into this as much as they do in small animal practice, and even there, nowhere near as much as you are going to run into in human medicine. Anti-vaccination is just, I'm sorry, I don't want to share my frustrations with you, but it's the one that really bugs me. Do you have a coping mechanism that you use when you've had a really bad case day, week, and just can't seem to find the happiness? I think the coping mechanism that you develop over time is that there's always happiness. What happens is you become fixated on the things that are frustrating you. And I think what you have to do is take a breath and look for the happiness, because on days where you're slammed and there's a ton of difficult cases, maybe there's someone you're working with who you just take joy in their being there. It could be a nurse, it could be a technician. It may be the client that says thank you, right, in the midst of everything, or someone that asks you how you were doing. And I think that's what you have to train yourself to do, is to find the joy and find the little moments when you can take that. Maybe it's coming home and just eating dinner with your loved ones, whatever it is. There's normally something, even if it's not work related, there are things in every day that are worthwhile. Maybe it's the sunset that you see when you drive home, but I think you have to look for joy in little things. What else do we say? How do we find those moments when we are not quite interacting with clients, patients much as yet, as in medicine at least? Yeah, I appreciate this. This is actually very, very true. Going through your education is a Herculean effort. It is a Sisyphean effort. You work hard every single day, and especially in this world of COVID, where you're not interacting with your classmates in the same way, and you're certainly not interacting with patients, and you're not seeing those successes that are going to really stimulate you. I think you have to look outside. Once you get into the practice of your profession, things actually almost, although there's more frustrations, there's more things to take joy in. So I think you have to do that with each other. I believe that really very, very much. Any good liners for anti-vaxxers? No, no, I don't know how to deal with that, because there isn't a way to win that. I should try to find it. The best line about anti-vaxxers I've ever seen was Jon Stewart on The Daily Show, and I don't remember it exactly, but he was sort of using this analogy of a zombie movie, and the survivors are in a house and they're being besieged by zombies, and they're nailing up the windows and they're blocking the doors, and that's the vaccination. That's what's keeping the zombies out. And then an anti-vaxxer turns up and just opens the door. I think that's the best analogy I have anyway. Why did I pick veterinary medicine over human medicine? It's actually a really great question, and I can tell you right now that human medicine never even made it. I never wanted to be a human physician. I've always wanted to be a veterinarian. I wish I could explain to you why. It's just like a lot of us, that was something I wanted to do. When I was a teenager, I spent all my time working on farms, working in a pet store, and it just solidified. So there's nothing there that made me want to do human medicine. Weirdly enough, now that I'm a veterinarian, I actually really, and I interact a lot with the medical school, I sort of now look back and think, oh, wow, I wonder why I didn't do medicine. Would I have made a good physician? But it never even crossed my mind, to be honest with you. So any other questions? Hopefully I've managed to answer some. Oh, I think there might be a couple more. Sorry. Yeah, when clients get mad at you and argue with you about treatment options or what should be done, if there was a magic solution, sorry, I've just been joined by one of our cats. I apologize. You can probably see the tail in the background there. If there was a magic word or a magic solution, our lives would be much, much easier. So there is no comeback. There is no magic thing. I think what you have to do in the end is be empathetic. You have to understand where that person is coming from. And if you can understand where they're from, you may be able to reach out to them, probably not through a logical argument. And to be honest, I have clients that I cannot understand where they're coming from. I'm not going to pretend I have the solution to this, but sometimes if you can actually understand where they're coming from, that can really help. And someone asked me, what was my biggest struggle going through vet school? Okay, so first off, it was a long time ago. It was in a different country. It was a very different situation. And I think time plays tricks on you. That's the other part of this. So I wish I'm not going to give you a fake answer. My honest answer is I enjoyed vet school. It was a very different form of education than the education you get in North America. It was a different system. We went into vet school straight out of high school. But what you learn to do, and this is where I think you guys are going to struggle this year, is you learn to rely on your classmates. And you develop a camaraderie with classmates that you will never have with anybody else, because going through school is tough. I'm not going to say it's not tough. It was tough going through vet school. But you had a bunch of people with you who were going through exactly the same thing at the same time. And that means you develop friendships that are really, really supportive. And you can develop coping mechanisms with those people around you. And this one probably will have to be the last question, but I actually think this is an incredibly important question. And someone asked, how do you deal with increased expectations in medicine? I think that is one of the hardest things to deal with. And as a veterinarian, I am not qualified to speak to that, because I believe that the expectations in veterinary medicine have increased, but they have not reached the level that I believe they have in human medicine, where the general public has expectations of perhaps all of us that go beyond the possible. They think that we know everything about everything. They think we can do everything. And they think that if it doesn't work out for them, it's somebody's fault. And that is incredibly difficult to deal with. And in the end, what you need to do is, when you've had a difficult case and perhaps things didn't work out exactly the way you wanted them to, you need to take counsel and you need to take advice, first of all, logically from yourself. You need to be able to self-reflect and be self-critical and ask yourself, how did I do on that case? Right? Because don't praise yourself. Don't give yourself a pass every time. You need to be aware of what you did on that case, because if you do that, you can learn from it and move forward. The other thing you need to do is you need to have people around you that you can trust their feedback. You need to have good teachers, you need to have good mentors, and you need to have good colleagues who will give you good feedback. So when they tell you you did everything you could, you believe them. And the only way you'll believe them is that when they tell you you did something wrong or could have done it better, that you also believe them when that happens. So sometimes what the client tells you, what the client's family tells you, you have to not ignore, but you have to sort of compartmentalize it and not let it get through into affecting what you know to be true. Someone else's opinion of you, certainly someone who's upset, doesn't always actually help you. So I think that's probably what I would say to that. But the expectations that will be placed upon you when you graduate can almost be crushing, because nobody bats 100. I guarantee you that. I have made mistakes. I have had things go south on me. I have had cases where there have been really unexpected outcomes, and I've had to break news to clients, and I've had clients that have been very, very upset with me. And that's something you have to learn how to process. And I think that's another whole topic. But I want to just finish up by saying, I think you guys have chosen amazing careers. I'll tell you right now, I love my career, even though being an associate dean was never on the cards for me. I was going to be a dairy vet in the southwest corner of England. Now I'm the associate dean in Saskatoon. But I've loved every part of my career. The veterinarians I know pretty much love their careers. My mother was an amazing nurse who just was such an old-fashioned nurse, but loved her career. And my friends who are physicians also, on the most part, really love their careers. I'm not saying they don't have bad days, but in the end, you're doing something that is truly, truly meaningful, in that you're actually helping to improve people's lives. And that is really important. So I think that's pretty much the end of the questions here. And I just want to thank you for your time this evening. I know you sort of had to be here, but I also appreciate it is the evening and many of you probably have other places to be. So thank you for your attention and have a good evening. Bye for now.